Because if you're using benzoyl peroxide, salicylic acid, tretinoin, all these different things, those can add up. It may be one of those things where you have to step back and start using something every other day or once every third day and build up until your skin can get used to it. Especially in the winter months, people will notice their skin isn't able to handle what it can in the summer.
Mm-hmm. Definitely.
All right, Dr. Green. Samari asks, what do you think about Murad products?
So I actually like Murad products a lot. I like them for rosacea. When I was working as a nurse, one of the common products we prescribe is the Murad products, and we always use it in patients with rosacea. Very gentle, can help with redness and irritation. I think it's a nice option. I think it's available at Sephora and stuff, if I recall. So that's a good option.
I agree. All right, Lucy Love 5. Why does tretinoin make your face burn? I usually use Estee Lauder / CeraVe moisturizer. So I get this all the time with tretinoin because it can be irritating. Sometimes it depends if you're talking about a prescription retinoid. There are different strengths of that. I commonly will back patients off. And then the over-the-counter adapalene is kind of one of the more gentle ones. Your face will eventually adapt to it, but you may not be able to do it every day. You may not be able to do it every other day. So I would say start off maybe every third day and try to build up. The other thing, too, is a lot of people don't know how to apply it. So what you want to do is put a pea-sized amount on the finger and rub that in across your whole face. So it's not a very thick layer. You also always want to get a good facial moisturizer to go along with it, something that's non-comedogenic, non-acne forming, that's made for the face. Anything that's not made for the face can sometimes make acne worse. But I hear this all the time with tretinoin. So I'd back off in the frequency, make sure you're putting on an appropriate amount. And if it is a prescription, you could always talk to your dermatologist or whoever's prescribing it about going down in the concentration.
Yeah, it comes in so many different concentrations, and even now there's some things like Altrino, which are lotion forms of tretinoin, and those are very gentle. So that's an option for you. And don't be afraid of moisturizers, because if you're using a good oil-free, non-comedogenic moisturizer, you'll do just fine. And people just get worried, like when they're treating their acne, they're worried about putting moisturizer on their face because they're afraid they're going to break out more.
Sure. And you always have to remember with the tretinoin, too, whenever you're treating acne, you're actually looking for a little bit of a light peel. Like a little bit of peeling. That's kind of to be expected, and it's usually well controlled with the moisturizer. Yeah. It doesn't necessarily mean you're overdoing it. But what you were describing, the burning, I do think that there are ways around that because that happens to a lot of my patients.
Yeah, absolutely. It's one of the most common things. Expect irritation and
sure.
redness.
All right, from 501 Smalls, how do you feel about collagen products?
Yeah, that's a good question. Hot topic. So collagen products, from a scientific standpoint, it doesn't make a whole lot of sense to me to, ingest oral collagen or necessarily maybe like fragmented collagen peptides on the skin I can kind of maybe get, but ingesting them, taking them as a pill or whatever, I wouldn't really expect that to work from that standpoint. But there was a study that was published in the Journal of Drugs and Dermatology that did show that it helped with wound healing. So, I mean, there are some published studies. I don't know like how good of a study necessarily that was, but that is the reality of it. So.
Yeah, I'll hedge my bets as well. It's controversial. I don't think there's a ton of great data showing that collagen products have a noticeable difference. But I have had people come in and say, I use this product, I really think it helps them, and for those people I say go for it. But I don't have a ton of evidence to point to. Let's see. So Stephanie said hi. Hi, Stephanie.
Hey there, Stephanie. Thanks for joining.
All right. And then Neens88, what are your thoughts on hydraulic acid?
So is it supposed to be hyaluronic maybe?
Yeah, probably.
Yeah, hyaluronic acid.
Hyaluronic.
Yeah. So actually, I think my most recent video was actually on that, and it's really great. It's one of the best over-the-counter products that you can get, and it is it's like gentle enough for anybody's skin. So despite having acid in the name, it's not something that irritates or bothers most people. It's it basically is what's called a humectant. So you put it on the skin, and it tends to take water from the air and environment, or if you've just freshly washed your face and you apply this to your skin, it can hold up to 1,000 times its weight in water, so it give you a nice dewy look. Better used in the spring and summer because it's a little bit more humid out. In the wintertime, it's kind of hard. If you live in a real dry environment, it's kind of hard, but it's something to consider for sure. I like it.
Yeah, I agree. The hydraulic acid, I think some people it gives them that dewy look that they're kind of looking for. It may help moisturize the skin. And there's really no drawbacks. I've never had anyone come in using hyaluronic acid that had a bad reaction to it or didn't tolerate it.
Right.
So with that in mind too, I think the risk is relatively low. So I'd say try it, and if it works for you, then keep using it. If it doesn't, then I don't think it's It's not my top 3 of what you have to have in your skincare routine, but it's certainly something to add on.
Definitely.
All right. Let's see. Lori Lorden Hudson 99. What are your thoughts on skin tag removers that you can buy yourself to remove?
Yeah, so I'm certainly not a huge fan of them personally. They, I'm sure they put like some irritating chemicals or something in it. It kind of falls into the same category as the milia. So if you're, going to treat milia, just go to the dermatologist and pay a little bit of money and have them removed, and they're safely removed. You leave, they're all gone, and it's not a big deal. You can waste a lot of money on over-the-counter products and just not get anywhere. Do you care to get the charger for laptop? Thank you.
Also, I will say there are other things that can look like skin tags that aren't necessarily skin tags. So sometimes, I've had patients use them and it works okay, but there are times that they'll want to use a skin tag remover for something that's not a skin tag, and I'm glad they came in and didn't do it. So
yeah, absolutely. Yeah, there's definitely been melanomas that were in skin tags and basal cells these are common types of cancer, and they can be in skin tag. I'm at 1%.
Sure. And so let's see. Cinnamon Girl 73. I have rosacea. When I drink red wine, it's worse. So we get this all the time. Rosacea is a super, super common skin condition. It's in the acne family. I always talk about them as cousins. But it's known for its hypersensitivity and its flares to different things. Some people it's sunlight, some people it's alcohol, and they notice that they've got some increased flushing with that. So,
Yeah, I mean, it's definitely one of the triggers for rosacea. And some people can have it and not have any trouble, and other people, use it and that's one of their known triggers. So with the rosacea stuff, it's just more to be aware of what your triggers are. Is it sunlight? Is it spicy foods? Is it hot beverages? Is it alcohol? And just go off that. Just be aware that those things can affect it.
I have some patients, and I think we've talked about this before. There are cosmetic products that have, so rosacea, normally people have red skin, like that's what their flares are. There are products that have green tints to them in their cosmetics, which can help conceal some of that redness if that's people's main concern. I don't know if you have any products in particular that you like.
So, I mean, a couple of the things here, and I'll pull it up for the people on Twitch and YouTube. But this is Dermablend. It's a really, really nice makeup that goes on as a concealer, and you can use that. I'm gonna actually shift it over a touch here because it's in the chat. So you can use this. You can even mix it with SPF, and then we'll show it for TikTok there. So that's Dermablend. Green tinted makeups and things like that can help with redness too.
Sure.
So those are your options.
I've got an interesting question from Diamond606 I want to address. This is, I have limited scleroderma. I hate the lines around my mouth. What injection do you recommend? And I'm going to hedge my bets a little bit here because a big part in determining what injection to get is going to involve seeing you in person, seeing exactly what we're dealing with. There are a lot of different options, and I kind of think sometimes these are snowflakes. That you have to, each person needs their own personalized approach. What's best for one patient is not going to be best for the second patient. There is no cookbook for this. So I would hesitate to recommend anything in particular. I'd go to a cosmetically trained, I prefer a cosmetically trained dermatologist because they're trained in fillers. We're trained in the different options that we have. And especially since you're dealing with what is not a super common condition, you're going to want somebody that has a lot of experience in what products are available.
Yeah, exactly. I totally agree. It's definitely something that you want to see a dermatologist in person about. It's a thing that I've, thanks for the follow, Hunter, appreciate it. It's definitely something that I get a lot of questions about, but it's, you got to see somebody in person. That's not something you want to just get like an online consult for or whatever. I agree with.
Yeah, totally agree.
Appreciate the follow again, Hunter, on Twitch.
Yeah. All right. Liz Pemberton, what is a retinol alternative for people with rosacea?
Retinol alternative with people with rosacea. So, retinol, you bring up a good point because it definitely can irritate the skin. So if you got rosacea, it definitely can cause you to have trouble. There's not a lot that's necessarily like retinol, but aside from there's a plant-based thing called bakuchiol, and that is, sometimes people say that's safe for like women in pregnancy. It's it's plant derived. It literally smells like a plant when you put it on your skin. So that's like maybe one of the weird things. But it they do claim that it's hydrating. They claim that it has retinol like effects. So maybe that would be a bit more gentle for you. If you're using rosacea, I mean, azelaic acid, is a good option too. If you get any rosacea bumps and stuff like that, you can get that over the counter too. So.
Yeah, I agree. Even though I consider rosacea and acne to be kind of cousins in the same family, unfortunately, the retinoids don't typically work as well in the rosacea, and people notice that it causes them to flare. So you bring up a good point. All right, so Jess Kitchens 2019. I have acne scars and I don't know how to get rid of them. Please help. This is a super common question we get all the time. So the way I always approach this is number one, let's stop the process that causes the scarring. So if you're still having active acne that's resulting in scarring, I'd say you need to get in with a dermatologist. Let's prevent you from having any progression in the scarring. After that, there are a lot of different options for acne scarring. There are lasers. There is some different things called subcision. A lot of different specialized techniques. I don't know about over-the-counter regimens as well. I'm more familiar with the things that we do in the clinic, but it is a pretty common complaint. But I guess my order of importance is stop the process first, and then there's a lot of things I think coming in to see a dermatologist that specializes in some of these cosmetic procedures would be good. I don't know if you have any other thoughts.
Yeah, it's a good point. I mean, I totally agree. You got to shut the process down first of all, because anytime, especially if you got skin of color and you get a new inflammatory lesion, you're going to be left with a dark mark there for like months to years, and it's real frustrating. We talked about procedural options, peels, microneedling, lasers. There's now radio frequency microneedling, which is even better. Subcision, as Perry mentioned. So there's a lot of different options for it. Over the counter, you may get some, if you're concerned about the hyperpigmentation that's left behind it, you could use some of the products that help with hyperpigmentation, like alpha-arbutin, kojic acid, your adapalene, or maybe even your AHA, BHA pills that are like over the counter and gentle.
Right.
So there's a lot of options, but you want to make sure to get your acne under control. And if you can't do it in 3 months with over the counter products, you need to go see your dermatologist. That way you can make sure you're getting the best treatment.
Yeah, and once again, with a lot of these procedures we're talking about, everybody's a little bit different. No one's acne scarring is exactly the same. So what's right for one patient isn't right for another.
Yeah. So we got a compliment from Margarita. You could probably pronounce this better. Perry speaks Spanish.
Oh, not that I'm on the spot. It's been a while, but Carrasquillo?
Yeah, Carrasquillo. So it says two pretty best friends. So there we go.
Bring it in.
So that's nice of you. Thanks so much.
Kind.
And then RP on YouTube asked, OTC acne care for a 15-year-old, proactive and Curology irritates her skin. So that's something we've addressed a little bit earlier in the stream, but a lot of acne products are going to irritate your skin. If I was going to give you 2 options for over-the-counter treatment of acne that's affordable for you and effective, I would use CeraVe 4% benzoyl peroxide wash in the morning, and then use adapalene gel from La Roche-Posay or Different at bedtime. Pea-sized amounts, start like Monday, Wednesday, Friday, and increase it to nightly as tolerated. So that would be a great option. It's honestly where a lot of dermatologists would kind of start you off. But do that and see if that gets you there, and if not, then see your dermatologist.
Yeah, and I want to echo the 4% benzoyl peroxide as well. Whenever you go into a store and you look for benzoyl peroxide, it's in so many different products. It's in so many different concentrations, and it's irritating. So people don't want to use something stronger than what they need, because then it causes their skin to be irritated. They're not able to get their adapalene on.
Right.
So I think the 4% is a sweet spot.
Yeah.
I think it's enough that it does its job. I don't think you get a ton more. If you do the 10% and you like it, that's fine. But if you're one of those people that finds it too irritating, I think scaling it back and still getting that effect is totally reasonable. That's what I recommend.
Absolutely. And studies show that too. It's like you're going to get just as good of effect with 4 or 5% as you are with 10%, but you're going to get less irritation. The places where I like using the 10% is on the back and chest and stuff like that as a body wash, because it's a lot less sensitive skin. The only thing you got to know is just make sure to wash your skin thoroughly with just clean water. Make sure it's totally dry before you put on your clothes, because it will bleach fabrics and that. Hunter on Twitch asked, I struggle badly with allergies and allergy shiners. Any tips on how to resolve these? I use an antihistamine and nasal spray already. So, you could see a doctor to talk a little bit more about allergy treatment or potentially going up on your antihistamines, but that's something I'd probably talk to your doctor about. The allergic shiners, your eyelid skin and that is very sensitive to airborne allergens and stuff like that. So you want to make sure you're doing everything you can to keep that skin barrier strong. So good moisturizers that are fragrance free and that can be helpful. But that's kind of where I'd start with it. But you may need to talk to So they're getting, Hunter's getting specific. It's 180 fexofenadine tablet, and it's the third antihistamine. So sometimes we even like double antihistamines, but again, that's something you got to talk to your doctor about. That's a little bit more.
Yeah.
So Margarita, by the way, says, "Oh my God, you pronounced it perfectly first time ever."
Thank you, Margarita. I needed that for my confidence because I got put on the spot today.
Yeah.
You had the 2 R's. It's always difficult.
So, are you a hair expert?
Am I a hair expert? I wouldn't.
Technically, we're hair experts.
I was going to say, I mean, I wouldn't. Maybe.
Why does gray hair have different texture?
Well, I think a lot of people that have gray hair are kind of in a different point too. Whenever you're comparing it, if you're comparing an 18-year-old's hair that doesn't have any gray to a 40-year-old man's who does have gray, you're kind of comparing apples to oranges here. So the hair may be a little bit thinner whenever you start graying. But in terms of the, I haven't actually noticed that much of a texture whenever I'm looking through it. I just do think you're kind of comparing apples to oranges here. But maybe I'm totally missing it. I haven't noticed that.
Well, yeah, and people have like full, thick hair in their youth, and just with hormonal changes in time, I mean, the density of your hair is going to change and things like that. So maybe that's other stuff that you're, kind of detecting. So.
Yeah, and I guess maybe it's not, it may be less healthy. But now you've got more people. I've noticed a lot more people are using the touch of gray or going completely gray.
Yeah, absolutely.
So I want to answer this question by Patricia Jacobs 14 because I think it's a really pertinent one. What is best to help clean your face while having to wear a mask all day?
Yeah, so it's good question.
It is.
So to clean your face, it's a delicate balance because by nature the masks are irritating to our skin barrier, right? But a lot of the reasons that you get acne under the mask are the same reasons you get acne kind of normally. You're having this like little occlusion of the sebaceous units and that, and you're getting little pimples and stuff like that. So it's a delicate balance between mixing something that's gentle, but still going to be keratolytic or comedolitic and open up pores. So what my favorite is actually the Vichy 0.5% salicylic acid cleanser, and I don't know if I have it up here now, but that's one of the best things that you can use because it's very gentle. You could even use a 2% salicylic acid, but it may be a little too irritating. But look at the Vichy Phyto Action 0.5% salicylic acid cleanser. It's affordable, it's effective. I think that'd be a nice option for you, and certainly a relevant question in the current times.
Sure.
So Vladimir says, "Hello, what can I use for textured skin?" So textured skin on social media is one of the hottest topics. I mean, everyone has like issues with that, and it can be somewhat challenging to treat. The things that come to mind, similar to the Masny, using a salicylic acid, that's a BHA. You can use that as a cleanser. That's going to help someone with texture. If you're dealing with textured skin off the face, that could represent like keratosis pilaris or like chicken skin. And you can use like a urea-based or an ammonium lactate-based moisturizer like amlactin. Those things can all be helpful. So we talked about acids for the face. We talked about salicylic acid, but you could also use your other alpha-hydroxy acids like mandelic acid or lactic acid and things like that, and that can really help with skin texture. So I sure hope that helps you. And then Margarita asked, what type of skin does Dr. Perry have and your favorite products?
What type of skin do I have? Ooh, I guess if we're getting real technical, we grade skin on a Fitzpatrick scale depending on how easy you do or don't burn with sunlight. I'm more on the burn side, so I'm probably a type 2 is what we label it for anybody that's recommended. I really follow, for those people who weren't here earlier, I kind of have 3 products I recommend. And really it's a big 2 and then a loose 3. But the number 1 product for healthy skin or preventing aging is a good sunscreen. There's a lot of good options out there, but the sun is what causes a ton of wrinkles. It's what causes early aging. So I think adding that to your daily regimen every day is number 1, number 2, number 3 in terms of importance. Then I think a topical retinoid, something like an adapalene over the counter is what I like, and then I use that at night. And so that helps, I think, also with wrinkles, helps with collagen formation. There's a lot of things that retinoid does for your skin. If I were going to make it a 3, so I could have a big 3, I would do the vitamin C. And I don't always do the best job of that, but the vitamin C would be my number 3 option. And then sometimes I do feel like, and some people may be different, I think putting things on your skin every day is difficult. It's like another thing to add in your routine. So number 1, putting it in your routine the same way you wake up and brush your teeth is important. And just sticking with it. But sometimes when people try to use, I think they have like 10 or 12 products, it's hard to keep up. And you don't see results with most products overnight. You don't see results in a week. It's something you really have to be dedicated to. So come up with a regimen that you can follow.
Yeah, definitely. You want to like be using it. Most of these things, especially like with retinoids, for example. I know people that started a retinoid 20 years ago, and then they look at the people around them that are their peers at that point, and then you realize like how big a difference it makes. But it's something that you're like, damn, like 20 years ago I started this. I'm so thankful I started it then.
Yeah.
Because it makes a huge difference over the long run. You know, you're going to continue to age, but you want to age as gracefully as possible, basically. And vitamin C definitely. I mean, it's got benefits for pigmentation. It's got benefits. It's antioxidant. It's photoprotective. So it's not only for like replacing a sunscreen, for example, but using it under a sunscreen. And if you actually look at studies of people that got sun exposure, if they had vitamin C on their skin, vitamin C and E on their skin, and then one where they didn't, they actually burn worse. So and then as Perry mentioned, the collagen benefits. So it helps promote collagen, and it helps also protect the collagen that you have.
Sure, and I will say if I find cigarette smoking also causes people to age and have wrinkles earlier as well. So if anyone's looking for another reason to stop smoking, always add that on too, because that causes it to happen a little bit quicker. Okay, so Nat25391, thank you for asking us a question. Nat, what ingredients cause milia?
So it's tough. I mean, you may want to look up if you're concerned about anything. Basically, it's comedogenic, occlusive things, essentially. Now, it's interesting because it's not everything that's thick that's necessarily comedogenic. So, like, you can use Vaseline. Apparently, it's non-comedogenic. I don't personally trust that. I'm not going to slug it out and put Vaseline all over my face.
I agree. And sometimes we get lost in our terms, what we call comedones and what we call milia. People have different definitions for that. If you're talking about milia in the strict sense where you get cysts underneath the skin, a lot of times that just happens either due to trauma or just can happen, I think, more incidentally. So sometimes it just depends, are we talking about more of the comedones or blackheads and whiteheads, or are we actually talking about actual milia itself? But I agree with everything you said. The comedones in particular, there are a lot of products that can cause this. I'll actually take a step back because I've had a lot of this in clinic recently. People will get these open and closed, or I should say blackheads and whiteheads across their forehead and their temple. And sometimes people will use different types of oils to style their hair, and then that'll get down on their forehead. And so I always tell people, be really cautious. We actually call it pomade acne.
Yeah.
If you are using some of these things that can be occlusive that you were talking about, that you try not to get it on your forehead, because you may notice that you're starting to get breakouts up here, and a lot of times that's because of the products people are placing, or if you're one of those people that likes to rest their hands and things up here, you'll notice you get
it's
breakouts.
like a mechanical form of acne.
Yeah.
So Courtney on Twitch asked, I got prescribed minocycline and tret, and it has helped me so much. I am worried my acne will pop back up when I get the mino done completely. What can I do to prevent that? I use alpha-arbutin, niacinamide, and tretinoin and CeraVe moisturizer. Should I add vitamin C? So the vitamin C is probably not going to help you with your acne necessarily. The niacinamide is somewhat anti-inflammatory, and the alpha-arbutin is going to help dark spots fade a little faster. But basically, we usually put people on antibiotics to help control difficult acne up front, but it's not a cure for acne. So sometimes people are either going to grow out of acne, or we're going to treat them with something like isotretinoin or Accutane, and that's actually going to be what basically cures their acne permanently. So in this case, your tretinoin is the encore that you're going to continue for anti-aging and anti-acne benefits going forward. So you probably may want to be on we put people on antibiotics about 3 months or something, and then we try to back off of them and let the topical medicines do the work there on out, because it minimizes side effects, it's easy to tolerate, and that. So probably using your tretinoin going forward is going to be your solution to keep your acne down.
That's the big thing too. People will use their antibiotics, the oral antibiotics, they'll get better in a way they never did before on the topicals, and so then they stop the topicals. That's not the point of the antibiotics. The point of the antibiotics is you're kind of past where topicals can help you. At some point, you're severe. This gets it back under control, and the topicals are supposed to keep it at bay. So it's pivotal that even while you're improving with this oral antibiotic, that you stay on the topicals that your dermatologist is prescribing, and hopefully when you come off of it, that's enough to maintain you. Okay? It doesn't always happen, and sometimes people have to go back on antibiotics or we have to try different things. But if you go cold turkey off the antibiotics and you don't have that topical regimen in place, you will almost certainly flare back up.
Yeah, absolutely. So let's do a rapid fire on TikTok. We're gonna go through some ones here just as quick as we can.
All right, this one's a little bit. So Surya Destamana, it says, I have atopic dermatitis. I'm using mometazone 1%. Can I use it while pregnant? Any choices? I always hedge my bets. I never tell a pregnant woman to take anything without talking to their OB, ever. So
Yes.
I always am in concert. So I would say anything you want to put on your skin, anything you want to take orally, needs to be talked. You need to talk to your OB about it to make sure it's safe. So that's where I'll hedge my bets. I don't know if you have something
No, I
like
totally
that.
agree. Talk to your OB. Make sure things are good. You want to be safe, And then who we got here?
All right, so
Retinol.
Pink Pinky, 123. What retinol serum is good for combination skin? I'm 39.
Yeah, I would actually, instead of using a retinol, I would go ahead and use a retinoid like adapalene. Get it from the La Roche-Posay. I do have a link to my bio.
Consensus Jasmine, anything to use for hyperpigmentation?
Yeah, so many things for hyperpigmentation. Azelaic acid, alpha-arbutin, vitamin C, adapalene. All these things can help, and if you just scroll back a few videos, I've got a lot of hyperpigmentation videos, or you can even find me on YouTube, and I do a whole segment on hyperpigmentation.
Sure. Cherry on Top 91, what's the best product to add to your skincare routine to get glowing skin for your wedding? I think this is Lauren Cherry, so thanks for chiming in, Lauren. I really appreciate it. So, best product to add to your
Is this
skincare
one of
routine.
your friends?
This is future sister-in-law.
Oh, wow.
Yeah, who's on. So
Okay,
thanks for
very
coming
cool.
on and supporting. I know we've had some
Nice.
skincare talks in the past, so I appreciate it, Lauren. Best product to add to your skincare routine to get glowing skin for your wedding. Her wedding's in May. You're doing a lot of them, Lauren. I think the topical retinoid, making sure you clean your face. Don't alter it. If you have clear skin now, don't alter it. Don't break the routine you have.
Right.
You're actually, since we're in June, if you're talking 3 months out, that's enough time to get improvement with acne. One of the issues is if you're 2 weeks out and you have acne, that's a little bit harder to do. Sometimes you have to go into a dermatologist to kind of get some more quicker acting things.
Yeah,
like a
sometimes we'll do like a little prednisone
little-
for a second, or we'll inject them or something.
Exactly.
Yeah, so just a real quick one. Augustina says, can I use Mineral 89? That's the hyaluronic acid by Vichy, followed up with vitamin C. That's exactly the way I use it. Yeah, so that's totally fine.
All right, so going to Asima Had 35, best wrinkle solution. Please tell me. I know I've said this, so I'll be quick. Sunscreen, retinoids, vitamin C. Those are my big three.
You got it. And some of the best products are linked to my bio on TikTok.
I should say topical vitamin C, not oral. We've been talking about the topical solutions. Anything to use for hyperpigmentation? That's a big question.
Yeah. So again, I think we just kind of hit this. It might have been the same person that asked it, but I would check out my YouTube video on hyperpigmentation. I just kind of review all the options there. You don't need every one of these products. You just need maybe one or two, and the most important thing you can do is a great tinted mineral sunscreen every single day, because you're not going to ever get rid of hyperpigmentation without protecting your skin well like that.
Sure. How to hydrate irritated and dry, sensitive, rosacea skin? Great question. I would always find a moisturizer that's made for the face, and then make sure you're not using. There are a lot of things made for the face that have irritating things in it, like salicylic acid, benzoyl peroxide, that are great for acne, but not always great for rosacea. They can cause you to be more irritated. So make sure you're using a gentle, moisturizing cream, and you can use it up to twice a day. If it's made for the face, it's not going to cause you to break out worse.
Right. Yep.
All right.
What's your? We also got. What's your astrology sign?
I think I'm a Capricorn. I think my birthday's January 1st, so I think that's a Capricorn. If I'm wrong, please correct me.
There we go.
But yeah. What's your...
I'm a Cancer.
You're a Cancer?
Yeah, I'm June.
All right.
Crab life.
All right, Jackalover 72. What is the best cream for scars? I've had a few biopsies for cancer and hate the scars on my chest.
Yeah, so probably, off the face, you're probably going to need to talk to somebody.
Yeah.
About procedural options like microneedling, lasers, those kind of things. They can be pretty deep and irritated. Margarita's headed out on YouTube. Love you guys. Have a good day. Thanks so much. Thanks for joining. Great questions.
Thank you, Margarita.
Yeah, appreciate you.
I agree with everything Dylan said there. I hope one day I can visit your clinics from Daddy's Bad Girl. Well, we hope so as well.
Yeah.
I know Dylan over here, he's going to be done with his residency in about 6 months. I've got about another year and 6 months. And you'll be down in Evansville, Indiana.
Yep,
So
Evansville. Find me there.
That's right.
We'll leave it at that.
Which one is better between gel or cream type of tretinoin? Really good question. Tretinoin in itself can be irritating. So I feel like sometimes people tolerate the cream better than they do the gel because the gel is in an alcohol base, and sometimes that can be a little bit more irritating. The issue is a lot of times whenever people are getting this as a prescription, their insurance will dictate which one they can get. They won't cover the cream, they'll cover the gel, or vice versa, and there's never a good way to know which one it is. If they only cover the gel, that's fine. That just means a facial moisturizer will be even more important for you, and it's something you almost certainly need to add in from day one. And once again, start slow, or start low, go slow. So Monday, Wednesday, Friday with the retinoid, and then increase as tolerated.
Yeah, exactly.
All right. Can you improve old acne scars?
Yeah, so Nina, 89, thanks so much. So you can. It does take time. Using something like adapalene at bedtime, even though it's anti-acne, can also help with the scarring. And then you want to talk to a dermatologist about procedural options for you. Yeah. And then we got the pigmentation. Any advice? So Polly, any advice for skin that's bumpy in places? Laser. So what I would recommend actually is if it's on your arms and legs, which I probably get the impression that it is, you can use amlactin, and I think that's a nice moisturizer. It doesn't smell great, but it can help over a period of months.
All right, Boreanaz Andrews, best cocktail to prevent wrinkles. There's so much out there. There really is.
Yeah, there's a lot out there. So I like Vichy, vitamin C serum. You can do that. And then at bedtime, use adapalene. And adapalene is probably one of the best things you can get over the counter to help with wrinkles long term. If you're looking for a quick improvement, just hydrating your skin really well can make wrinkles less obvious. So, but that's not a long-term solution for you.
All right, Annie. Oh, I'm sorry, Annie. I'm going to butcher this. Kay Jogard. I butchered that. But how to minimize stretch marks on her teenage son's back?
Yeah. So, not a whole lot you can do to prevent stretch marks. If they're red, they can be treated with lasers, PDL lasers, that help the redness go away. But that redness tends to fade with time anyway, and they can become more silvery white. So, probably not a lot that you can easily do to.
Make sure you're moisturizing the skin. That is one thing that you can add, and you'll see that that people use that a lot for skin that's rapidly stretching. But unfortunately, we do see it quite a bit, especially in young boys that may start weightlifting or something like that, and they're stretching a little bit more. All right, I have white spots on my face. What can I use to help? That's from Judith Hatz F. Sorry, Judith, I probably mispronounced that.
White spots on the face, it's kind of tough because there's a lot of things that can cause that. So usually for people with white spots on the face, I recommend seeing a dermatologist. Sometimes it could just be skin dryness. There's things like vitiligo. Sometimes you get burnout of your melanocytes from the sun. There's so many things that can cause it. So I'd see a dermatologist. Sydney, real quick, on YouTube says, what's the favorite over-the-counter adapalene? My favorite is La Roche-Posay adapalene, and I'll show it to you here. This is a real nice product by La Roche-Posay. It's quite affordable. It's only like about $30 or so. So that's a nice product that you can do. Different also makes it, so either one would be just fine.
Yep, and that tube should last you a while. Remember, you're only putting like a pea-sized amount on the finger every night.
It's pretty much months.
All right, Samari 16, if skin is not moistured enough, will it cause breakouts? Good question. It depends on what kind of breakout you're talking about. Usually with acne, I don't think about too much with dry skin, but especially if you're somebody with eczema, dry skin causes breakouts, and people will get that on their face. So the answer is yes. I think moisturized skin in general is better.
Yeah, definitely.
All right. Which SPFs are your favorites from Neens 88? I say 50 or above.
Yeah. Definitely, I'd say, you can't go wrong with using a 50.
Yeah.
You're blocking 98% of the sun. Everything over there is a very, marginal, improvement in sun protective factors.
Yeah. So I agree. I think that's the safe one. Cio Walidnon 97. I'm using tretinoin cream. It helps my acne and PIH, but it's not brightening my skin tone.
So what's she using? Sorry.
She's using tretinoin cream.
Okay. And it's brightening?
So it's helping the acne and PH, but it's not brightening my skin tone. I will say I don't expect tretinoin to help with that.
Yeah.
I don't think if your overall goal is lightening of your tone in general, that's not really what tretinoin is designed to do. But it is designed to help get you back. I think it helps with pH, getting you back to the skin tone before you got the. When I say pH, I mean post-inflammatory hyperpigmentation or dark spots left behind after acne bumps or things like that.
Definitely. Vitamin C may help a little bit in the morning. And then your other thing is, instead of using the tretinoin 7 nights a week, maybe 2 nights a week or 3 nights a week, you could use a direct acid like glycolic acid. That may help a little bit with that factor.
True. Really common question from Jess Kitchens 2019. Actually, I think I already answered this once. I'm looking for something to repair my acne scores and make them go away permanently. I can't remember if we answered this earlier, but really, I think the best techniques for acne scars is to go see a dermatologist. I don't think there's a ton of over-the-counter. I always tell my patients, though, you got to stop the process that's causing the scars. So if you're still getting new acne, we need to nip that in the bud first. That way we stop the scarring, and then once we stop the scarring, we can kind of treat what's already there.
Definitely. And Sydney on YouTube says thank you. She's using actually tretinoin 0.1% cream, and she's saying she can alternate it with adapalene because we mentioned adapalene. But the thing is, if you have tretinoin 0.1, that's more effective. So use that every night. Don't worry about the adapalene. You don't need it, Sydney.
Yeah.
So it's a good question. I'm glad you brought that up.
Yeah. So reppin' middle SOC studs. Oily skin, 45 and PCOS. What's good for breakouts and hormones out of whack? Really common question, really good question. This is something where prescription medications a lot of times have a great role. We have different things we prescribe. Of course, we have to know the medical history and things like that. But sometimes people with PCOS find that oral medications can really help them out. Of course, the tretinoin and the benzoyl peroxide and things we've mentioned earlier can help with that. But sometimes when you have that hormonal component, you need a little extra kick. And that's a really good reason to see a dermatologist.
Definitely, yeah. Sometimes your OBGYN might be able to help you, but a dermatologist, we have a lot of options for hormonal acne. And it's a really big problem for a lot of women in their 30s. You know, maybe they didn't even have acne in their teens and stuff, but it can be really frustrating.
Yeah, Christy Boo says thoughts on home microneedling.
I don't like home microneedling.
Good,
yeah, no, because you can mess it up. You know, I mean, for one, the rollers aren't necessarily produced to a high quality, so that can be an issue. You know, you're rolling this roller on your face, and it's kind of not really entering your skin perpendicularly, so you get these things. If you're putting stuff on your skin and then you're microneedling over it, sometimes people get granulomas, which can be really hard to treat. So I wouldn't recommend doing it at home, and honestly, the ones you're going to get done in the office are going to be a whole lot more effective. So I would recommend doing that.
I agree. So I got out of order.
It's okay. It's hard. The chat rolls so fast that it's really hard to.
Great.
Sorry if we missed you.
Yeah. So Karen McAllister, 38-year-old female, recurring cystic acne suggestions. I suggest that you go see a dermatologist, especially if you're having cystic acne. You're at a higher risk for having scarring. This is one of those things where I would much rather see you earlier rather than later. So if you're having truly cystic acne, we've got treatments to help. There's not a ton of over-the-counter things I think help with cyst as much.
Right. No, you're exactly right. I mean, nothing over-the-counter is really going to get you there, and we definitely want to prevent scarring because, like someone was asking about how to get rid of scars permanently, and you can't really get rid of scars completely. You can just improve the appearance of them. So you want to see somebody as soon as you can.
All right. Millie Ruse, 86. What do you recommend for dry scalp? That's a good question.
Shampoos for dry scalp. Yeah, it depends. Are you actually having dry scalp, or are you having dandruff or seborrheic dermatitis? So I would just use like right now I'm using honestly Head and Shoulders shampoo. I actually really like it. The old ones used to be a bit drying and irritating, but I feel like the new ones are quite nice. Mm-hmm. And then you could alternate that even like 4 nights a week. You could use your regular shampoo. If you feel like you're having a whole lot of flakiness in your scalp, I might encourage you to purchase some over-the-counter Nizoral shampoo. It's ketoconazole 1%. It's available pretty much any store. And just see if you're having possibly a component of a yeast that's causing that flaking. So I just want to answer a few here from YouTube. So Vladimir says, what can I use for red acne scars or post-inflammatory erythema? So a great sunscreen, maybe one with niacinamide like Elta MD UV Clear and the tincture of thyme pretty much. And then Suckdeep Diol asks, what is microneedling with radiology? So what you're talking about is microneedling with radio frequency with RF. And what that is basically the really nice ones basically are microneedles that puncture into the skin. It causes columns of damage, just like a laser does in a way. But with the radio frequency, it actually allows you to place heat not in the surface of the skin, but in the deeper areas of the skin to induce some thermal damage too. So it's really cool because when they're insulated like that, you can actually use it in skin of color and everything too, and not worry about the hyperpigmentation. So basically, it gives the microneedling a kick and makes it a little bit more effective and allows you to like stimulate new collagen and that. So,
I totally agree.
Yeah, favorite chemical exfoliant. Mine is lactic acid. I think it's really nice. The Ordinary makes one. It's really affordable. It's not that irritating. And if you got a little bit of dry skin, it sure works great.
I agree.
Biotin causing acne, I don't think I really
think
about that
people
much.
talk about biotin for hair and nails, and usually I think the data's pretty mixed on it, but I actually never heard of it causing acne. But I'll look into that because that's new to me.
Yeah. I have to look at that one more. So
All
good
right.
questions.
All right.
Though.
So What is the best anti-wrinkle cream, anti-aging, and moisturizer for men? Really, my answer for men and women is the same: sunscreen, tretinoin, vitamin C. A lot of really good facial moisturizers out there. Just make sure they're made for the face, or they can cause your breakouts to be worse.
Definitely. So, just want to put in a plug here. So today we're streaming. We're streaming on TikTok, and it's pretty nice. But if you want even better experience, you can come over to YouTube or Twitch, and just starting up over there. We got a nice camera, really high quality. We got the mic that you see in the TikTok shot is actually not what's transmitting the sound for TikTok. So if you want to come over there, give us a follow. On YouTube also, I do like 3 to 5 minute videos. They're a little bit more in depth. On TikTok, I'm kind of limited to doing these 15-second videos. So a lot of people get frustrated. They're like, oh, it's so fast and everything. So come over to my YouTube, subscribe over there. New videos every Monday. I'm going to be trying to stream on Sundays at noon, just like today. So just want to let you guys know about those other platforms.
Okay. All right. So we'll go. We got such a ton of great questions here. So this is from Jenny Karagam. Once again, I apologize for all the mispronunciations. Can I use niacinamide with tretinoin at the same time?
Yep. No problem.
Agreed. We'll try to rapid fire somebody to see if we can get through
sure.
some
We
of these.
can. We're gonna try, bro.
I know.
Literally.
We always end up talking too much.
Yeah.
We want to make sure we answer your questions completely too, and we appreciate your patience staying on. If you can't tell, we are going in order, so we're gonna get there.
Yeah, we'll get there eventually.
All right. Prevent neck and chest wrinkling / creasing. Good question. Sun protection, especially on the back of the neck. There's a fancy condition we call like Cuto rhomboidalis nuchae or whatever.
Yeah.
I may be mispronouncing that as well, but I think the sun, especially if you're talking about on the back of the neck, is going to cause increased wrinkling as well.
Definitely, and don't forget. I mean, you can use your skincare products on your neck. You really should.
Sure.
The back of your hands, the neck, all those things. If you're looking for one particular cream, something I've heard a lot of people like is the brand Elastin makes an actual neck cream. This is Elastin. This is the brand here. And they actually make an actual neck cream that's real nice as Elastin. So you guys could potentially look into that. They make a neck cream that people love. So
Yeah. Can I apply? So this is from your Grandmasto Fungus. Can I? I love that
Nice name.
I hope I'm getting it
Solid.
right. Can I apply Vaseline or Aquaphor after tretinoin?
I don't personally like it. I like using CeraVe moisturizer. Technically, you can.
Technically, I don't think the Vaseline rubs in super well, and so I think a lot of times people put that on, they put the Vaseline on their face and it ends up on their pillow, and then they end up not using the tretinoin because they didn't like their skincare routine in the past. I mean, technically the products say you can, but I agree. I like something like a CeraVe. Brown spots on face, ton of different options. I always hedge my bets here because we have one for light spots on the face too. Number one, we have to know what the brown spots are. Are they sunspots? Are they post-inflammatory hyperpigmentation? Are they moles? So it kind of matters what the etiology of the dark spots is.
Absolutely. Yeah, I totally agree. Suck Deep on YouTube. Is microneedling radiology safe for melasma? So with melasma, you're at a very high risk for having further hyperpigmentation, so I probably would not recommend it in that. Although an expert using chemical peels can give you a nice result for that. And then Wendy asked about using home light therapy devices for acne and wrinkles. Does it cause any photo damage? I don't want to be counterproductive with my skincare. So it doesn't cause UV damage necessarily, but things like blue light and things like that may actually cause some hyperpigmentation. Now visible light, we know, plays more of a role in hyperpigmentation. So that's been my concern with some of those home light-based devices. I'm not saying I would never use them, but it's not causing UV damage, but it can cause hyperpigmentation concerns.
I don't use a ton of light therapy for my acne patients, though patients will ask me, is there any reason that it should work? There is science behind it that shows that one of the bacteria that's really involved in acne is susceptible to certain types of light. That's the reasoning behind using light therapy for acne. Some people, I personally have just done, I feel like I have a pretty good success rate in treating acne without it.
Right.
But it's out there, and I think it's a good question. All right. We want one from over here. So this is from Annie KK. What face wash can I use after, I think, a Vino cleansing gel for acne-prone skin?
So after what face wash?
Or maybe was that?
Face wash can I use after Avene clearance cleansing
Avene,
gel.
that's right. Okay.
So yeah, my favorite wash right now is actually the CeraVe. There's a CeraVe cream to foam cleanser. No, I got it here. This CeraVe cream to foam cleanser is awesome. It goes on as a cream and then it foams up. It's very cleansing without being over drying. And honestly, you may not even need to use, like, I don't know if that cleansing gel you're using, I love that. And you may want to give it a shot. It's probably like $8 or $9 and it's great. So you can check that out. I think you'll really like it.
I agree. I recommend that a lot. I think my patients really like it, and I've gotten good feedback on it. Is laser, so DWill1005, I like this question. Is laser hair removal permanent? Used to tweeze. Now I have discolored skin. Help. So, unwanted hair
Help.
help. It's a really common problem. We see it all the time, and sometimes the issue is too. People with skin of color will notice that they'll get darker areas of skin anytime they have anything done. Laser hair removal, sometimes it takes more than one time, but whenever I talk about people that have unwanted hair, that's the permanent solution. It may take one or two times. The issue is, especially since you're already somebody that pigments easily, you have to be careful with the laser, because the laser can do the same thing. In fact, it can cause you to even have more dark spots. So I would urge you, go to somebody that you trust, go to somebody that does this a lot and is used to having skin of color, that's been trained to use lasers, because you can absolutely get some of those dark areas as well. But if you're like, when people come in and they're like, I want a permanent solution, I want to know what I can do, the answer, I think, is laser.
Yeah, absolutely. Yeah, laser hair removal is going to give you the best solution. All these topical treatments are just so expensive, and they're not all that effective.
No.
It's kind of silly to do that. Wendy, you're welcome. And Suck Deep on YouTube says, when you say chemical peels for melasma, does that mean the ordinary AHA peel? No, I wouldn't use that if you have melasma. I would see it. You have to see a dermatologist, have a professional peel done.
Yep. Okay. The real Nikki G micro needling, 2 question marks.
Yeah, so it is good, but have it done in the office. Yeah, basically.
I don't like the home therapies either. I've seen too many people come in that have had bad results off of it. Yeah, I agree. What can you recommend for blackheads? This is from Prash Red Z. This is such a common question.
Yeah.
I really like a topical retinoid. I think you're going to probably pull a couple of these down. A topical retinoid is what we call comedolinic. Benzoyl peroxide is comedolinic, and salicylic acid is comedolinic. Those are all possibilities, but I think the
that's
tretinoin,
adapalene from La Roche-Posay. It's a nice option. And then use a good cleanser that's a little bit like the sal acid cleanser from Inky List or something of that nature.
Yeah, I agree. I want to hear your answer to this, Dylan.
Uh-oh.
Do peptides actually work for anti-aging? This is from Design with A&H.
So the question is, do peptides really get into the skin and do what they... I actually think that there's less research on peptides than vitamin C and retinoids that we talk about. But peptides, I personally like them. The Ordinary makes a cheap peptide serum called the Buffet, and it feels amazing, partially probably because it's mixed with hyaluronic acid, so your skin just feels awesome after you use it. But the idea behind peptides is you have these fragments of collagen and stuff like that, and it stimulates, it sends a signal essentially to your skin that, hey, your skin's damaged, I need to repair it. So that's the idea behind it. Now, is the science as good for it? Probably not compared to other things, but I like the feel of it. I like doing them. They're not currently in my regimen, but right now I'm actually trying out just It Cosmetics. I'm trying out their whole line. I'm doing it for a month, and I'm going to do a review of it after I use it all for a month.
That's awesome. I'm going to go with that. I don't know a ton of data behind the peptides, so I say the jury's still out. I'm not going to say they work or don't work until we get a little bit better evidence. But, once again, anecdotal, people come in and say things work, and I say if they think it works for them, as long as it's not doing any harm, I don't really tell them to change it. I strictly use PCA products. They work for me. I need a more affordable face sunscreen by Michelle Pritchard 61.
So I'm not actually familiar with PCA as a brand, but I don't know. I'm gonna give you 2 options. So as far as your sunscreen, if you can dish out $30, Elta MD facial sunscreen is by far I think the best sunscreen.
I agree.
Another nice option is is Color Science, and they make a really nice tinted sunscreen that's great too. So you could check that out. So those are two nice options for you.
All right. So Faith, Trust, and Wanderlust. What about white circles under the eyes? Once again, I'd have to make sure I knew what the white circles were caused by. I'm not sure just by hearing that. We hear a lot about dark circles under the eyes. I don't hear as much about light circles under the eye. I want to make sure I'm not missing something else.
Yeah, definitely.
Before I recommend a treatment.
Definitely. So definitely, if you guys aren't following on YouTube or Twitch, feel free to go over there. The links are in my bio on TikTok. or you can just look up SwolleMD on Twitch or YouTube. YouTube, I do longer videos where I give you more in-depth explanations of common skincare problems like acne, hair loss, things like that. So you can pop over there and check out those videos. I do new videos every Monday at 3 p.m., stream Sundays at noon. So I'd love to see you guys over there. Really trying to work on YouTube and Twitch to reach more people. So if you guys want to support in any way, love to see you over there.
Yeah. All right. So, Annie KK, I don't know if I answered this. Good moisturizer for acne-prone skin. I think we showed that CeraVe just recently.
Yeah.
I'll let Dylan put that back up there.
Moisturizer. So you can do
moisturizer cleanser. That's right.
So like the CeraVe, we'll stick it with the same brand. I mean, you can use this CeraVe. This CeraVe moisturizing lotion. It's non-comedogenic. It's real nice. So you can try that out.
All right, and then Mahogany 0518 with another common question. What about dark spots, sun damage? What do you think works the best? Sun damage, you got to have the sunscreen we talked about, the Ulta MD, which is what I use as well.
And then your adapalene at bedtime. That's about it. Kind of reverse some of that the best you can.
I agree. All right, Mary Bell Recto. Can I use niacinamide and alpha? Is it arbutin? Yeah, at the same time.
You can use those together.
Yeah,
that's no problem.
I developed a dark patch. So this is user with a lot of numbers. I developed a dark patch on my upper lip. It looks like a mustache. What product can I use? Thank you. It sounds like probably melasma.
Yeah, it could probably melasma, or possibly if you're using something that irritated your skin, you just got PIH. I mean, both things are. So sunscreen, that's zinc oxide sunscreen like Ulta MD that's tinted is going to be your best bet. And then you could do something gentle like azelaic acid or alpha-arbutin, the things we're talking about.
I agree.
There's a company called Topicals, and they make this cream called Faded, and this cream has 5 different pigment-fighting active ingredients. So this is a nice option for that. It's called Faded. You got to get ahead of this.
I was gonna say I don't think I've used this one.
Yeah.
Do you like it? What was it?
Give it a smell or put it on the hand.
All right, put it on the hand. I'm gonna lose my spot in the. It wasn't as startling as I thought it was gonna be. I don't mind it.
You don't mind it? Well, it doesn't smell.
Oh, there you go.
It doesn't smell great, but I honestly think it's kind of worth it because it has such good pigment-fighting ingredients in it. Apparently, this is the revision of the product too. It was apparently smelled worse.
Well, I don't feel comfortable holding the product and not being one to put it on myself. So if we're gonna bring it out, I'll show that I'll put it on too. All right, from it's not that bad once it's on, but I agree.
It fades fast.
It fades, but whenever you bring it out, it actually goes on pretty well, and the smell. But I will agree. Whenever you put it on your hand the first time, don't let me dissuade you. I don't think it sticks around.
Right.
What do you recommend? So this is from Bia Mehmet. What do you recommend for cystic jawline acne? I recommend going to see a dermatologist. I said this earlier. Once you start getting cyst involved, you start worrying about scarring, especially on the jawline. We used to think, and a lot of people still think, that has to do a lot more with hormones and things. So we have a lot of really good treatments in the office, and I think just getting it, I'd rather see these patients early to prevent complications that can occur later. So I think coming to see us is the way.
Can we get queued up 2 Coke Zeros, baby, if you don't mind?
No, that'd be
Thank
awesome.
You.
All right. Rika Stephanie Blodgey, any retinoid brands you recommend?
Retinoid, yeah, definitely. I love La Roche-Posay. You can see it's top shelf, decked out with La Roche-Posay. They make adapalene, or you could get different. I think either one would be fine, but I like La Roche-Posay. I do have it with a discount code in the link in my bio.
Right. I think, that wasn't always over the counter. It wasn't always available. It's been a total game changer because sometimes insurance is picky about what retinoids they will and will not cover for different things. Once this came out, I started recommending it all the time for all these different sorts of things. Let's see. Stephanie just had another question. She said, I started using the ordinary vitamin C, but stopped it because it felt like it burned. Is this normal?
Thank you.
Thank you.
So two quick just thank yous too. First for getting the Coke Zero, Bab, thank you. Right. And Shamza, thank you for the question. And tretinoin, I definitely think this is coming in from YouTube. By the way, if you follow me on YouTube and Twitch, the comments are a lot slower. So if you're not getting your questions answered, you can consider coming over there and dropping them because it's more peaceful. And then Kites, could you do a video on psoriasis? I certainly will. I'd love to.
I think that's a really good one. Yeah, it's really common. Okay, but the ordinary vitamin C stopped it because it felt like it burned. Is this normal? I haven't used the particular brand, but I think you have.
I have, yeah. So I have like 3 other different vitamin C's on the shelf back here. 2 of the products that are a little bit more of a cream base are the 23% vitamin C and hyaluronic acid, and then they have a 30% vitamin C and silicone. And those are both really highly concentrated. So if you're using vitamin C, you probably only need about 10 to 15% vitamin C. I personally use a 15% vitamin C from Obagi, but it's kind of expensive. For months, I used the 23% vitamin C, and it actually does irritate and tingle and burn a little bit. But most of the time, people's skin does get used to it. If you use it, you stop feeling that sensation the more you use it.
Once again, and the old adage is start low, go slow. So a re-challenge, I think, is appropriate. You could start using it on Monday and then give yourself a couple days and try it again on Thursday. And if you put it on that one day and it burns, then we kind of have our answer.
It's like barbecue, low and slow.
That's right. This is a lot of fun. So thanks everyone for all these questions. This is my first time on a live stream. It's kind of addicting being able to answer people's questions.
You're killing it.
We get to help so many people in the clinic, but this is such an awesome.
Yeah.
Awesome
how many clinics did we run through today? I mean, if you think about it.
Yeah, I mean a lot.
Yeah.
This is actually, and we get to counsel like however many people at once.
Yeah.
Oh, user, you don't have a name, but you say hello from Ireland. You guys are awesome. Thank you so much. That positive reinforcement. That's awesome. People are watching in Ireland.
Yeah, man. We see it oh my God, all over the world. Sweden, Ireland. I've had Japan, Germany. So it's super neat.
Skincare in the U.S. and skincare is the same as skincare in Ireland, so it all translates.
Yep.
How do you treat the dark spots under your neck from laser hair removal? Really good question, because lasers can cause what we call post-inflammatory hyperpigmentation. So just due to the inflammation associated with the laser, it can cause you to have inflammation. Number one, you probably shouldn't get those same settings on laser again. That hyperpigmentation will fade over the span of months. There are a couple of things that I'll let Dylan talk about that can maybe make it go away a little bit quicker. But one of the bigger things is whenever you go back to have laser for anything else, you don't need it that powerful. If it's leaving behind dark marks. So especially if you trust the place that you went and going back, they'll know exactly what settings they use, and maybe we need to back off a little bit.
Yeah, definitely. I mean, there's a component, how lasers work is they create heat, basically in certain areas. So you're targeting melanin in the case of hair removal, and you're trying to limit that heat. So if you get more thermal damage or heat damage under the skin, you can be left with dark marks. So, but the reality is if people are having like ingrown hairs and stuff on their neck and they're plucking them, they're going to end up with dark spots. So
sure. I'm
glad you did it. I would always recommend going to see a dermatologist for laser hair removal. Make sure you have an expert do it, because lasers can have some really bad fallout if you go to...
Also, it's a known risk of lasers, so just because you had some dark spots, that's something everybody I do laser on, I tell them one of the most common things that can happen is leave behind a dark mark, and it's a teaching point. But I agree. Going to see a dermatologist for your laser needs, I think, is going to help. So this is...
Courtney, real quick.
Yeah,
this is a question from a while back, Courtney. Sorry. Have you heard about any connection between THC and acne production? I mean, I don't particularly see people come in that use marijuana and have really bad acne because of that. I don't know if the studies are. No,
that's a really good question. You've got to think we probably don't have much data on there, because a lot of the THC-containing products have just recently become legalized. They've just recently become a little bit more mainstream. I know that we're not talking, but there may not have been, 20 years ago, we weren't doing studies on people that were taking THC. So I think the jury's out. I'm gonna hold off until we have more data, but not that I know of.
Yeah.
Do you agree?
Yeah, I think so. I think it will become more common. With time, since it's more mainstream, and we probably just need more studies. Few things real quick on YouTube. So Shamsa, what's the best product for post-acne scars, red, hyperpigmentation on the cheeks? So I would recommend the Elta MD UV Clear Sunscreen. It's linked in my product section where you can find those. And then K&A Powell says, combo skin, extremely oily. What can I do to help oiliness without drying? Use CeraVe cleanser and moisturizer, sunscreen, vitamin C, and different. So you actually got a pretty amazing regimen there.
Absolutely.
The CeraVe, I would recommend the foaming cleanser. The gentle hydrating cleanser sometimes doesn't make you feel as clean. So I'd recommend that. And then your moisturizer is good. You're using a sunscreen, which is good. Some people want to avoid moisturizers because they're oily, but that is kind of, you actually get better control of your oiliness with using a moisturizer. different, can definitely make your skin feel less oily. The one thing I would say you could add is you could add in niacinamide at night, which has been reported to help some with skin oiliness. And then a Curls View asks, any advice for 50-year-old skin? Is chemical peel good? Chemical peel is always good if you get it done with a dermatologist, get it done with an expert.
Mm-hmm.
So is steaming good once a week? I love going to the steam room, but I don't know if it has a lot of benefit on your skin. It kind of just feels better. And then cucumber's good for the eyes. Maybe from a cooling standpoint and eye puffiness, but probably not like long-term anti-aging. And then can I use a mask every night? You can. I mean, you just got to find one that works with your skin. There's a lot of nice hydrating masks. If you want to take a minute for yourself and do a face mask, that's good. You may not want a bunch of active products in it, but if you're using moisturizers, hyaluronic acid, things like that, you may like it. And then Suck Deep says, vitamin C product recommendations more than 10%. So I like, again, I've actually done a video on these vitamin C's. You can get Vichy vitamin C, that is a 15%. Obagi makes a 15 or 20%. Or if you're going to go the ordinary, the 23% is pretty good. Thank you for all the great questions on YouTube.
This is awesome. These are all great questions.
They're great.
Okay, so this one I made a little help with. Dr. Greeny, BMMet help copper coil giving me cystic acne. Are we referring to an IUD?
Yeah, I guess so.
That's my guess. Is when you say copper coil, I'm assuming we're talking about a copper IUD.
Yeah, that's kind of weird though.
Yeah, the copper is known. It's probably claimed to fame, and once again, this is outside of our kind of our field, but it doesn't have the hormones that are associated with some other progesterone or estrogen that are seen commonly in birth control. But once again, once we start talking about cystic acne, I think it's time to come see a dermatologist earlier rather than later, because topically there's only so many things that can be done, and if you start having cysts, you're at a risk for scarring. So come in, let's take a look, let's see. There may be other things too. I don't know if I'd pin it all on the copper IUD, if that's what we're talking about. Right. But I don't know. That you have a very kind of specialized question that would benefit from a clinic visit.
I mean, people that have hormonal-based IUDs do get bad acne. I mean, I do care what the research says, but a lot of these things say, well, it shouldn't worsen your acne. Well, in my experience, clinically, that's what we see. Clinically. Yeah.
And once again,
is what it is.
I agree. So I don't know if this is a question or not, but this is from Denise Rivero. It says the comment is clean skin.
Clean skin.
Yeah.
CLN, like the clean brand?
No, like the word. Like I'm going to take this as in recommendations for cleaning your skin. I think a mild facial wash, a wash that's made for your face every day, is something that everybody can be doing regardless of your skin type.
Yep.
So I'll say that.
CeraVe makes nice ones. La Roche-Posay makes nice one. The Tolerian, the La Roche-Posay products is really nice and gentle. But the CeraVe Cream de Foam is like definitely one of my best. And Curls View, Sucks Deep, Shamsa, you're all welcome. Happy to answer your questions.
Absolutely.
And then Augustina asked thoughts on the Effaclar Gel Moisturizer by La Roche-Posay for combination skin. So I actually haven't used that. So I can't say. I love La Roche-Posay. The Effaclar line is great, but I haven't used that particular product. So.
All right. So.
And Courtney, you're welcome on Twitch. Thanks for hopping on. Appreciate it.
That's awesome. So, Hope Layfield, my 23, has back acne. What can he do to help? So my 23-year-old son has back acne. What can he do to help this? You take that one?
Yeah, so back acne can be challenging, and in the majority of the time it's going to require an oral medicine or a systemic medicine to use. So you definitely want to see a dermatologist. I would go and get linked up. If, you may call a dermatologist and say, hey, we'll see you in a couple months. In the meantime, get him some Panoxyl 10% benzoyl peroxide wash. I do have it linked in my bio on my Amazon store. You can pop on there. You can start that wash. You just need it one time per day. And then if he's doing any type of sports or stuff like that, just make sure to just spray off with a normal cleanser, get that sweat and everything off of you. But use the benzoyl peroxide. That's going to help open up pores. It's going to help decrease bacteria counts in the skin. That'd be a nice place to start.
I agree. Larissa 5, can I use salicylic acid on dry skin? Yes, you can use salicylic acid, but I would try to make your skin not dry because it's going to dry it out more. So you need to add in a good facial moisturizer, especially if you're dry at baseline. You may have to use it twice a day because the salicylic acid is going to dry you out more. So just because you have dry skin doesn't mean you can't use these products. It means you're going to have to be more diligent in your moisturizing. And like Dylan said, a lot of people are afraid to use that because they think it's going to make their acne worse. But the right product is not going to make your acne worse.
Right, yeah, definitely. I mean, and remember, you can get the sal acid in different strengths, so you can get a 0.5, and you may want to start with that. Vichy makes a nice 0.5 one, so you could check that out.
Yeah, I mean, you could absolutely, once again, start low, go slow. You can start every third day and work your way up. But just because your skin is dry doesn't mean you can't use any of these products. Can you talk about, so this is from Jan Decker 25, can you talk about collagen for skin, hair, nails?
Yeah, so collagen, the oral collagen supplementation has been a popular topic recently. There's not a lot of good research that shows that it helps. So it's not harmful, though. So if you like it, you want to feel like you're getting benefit from it, you certainly can continue doing it. But it's not something that there's a whole lot of research on so far. So just don't waste a ton of money on it if you're going to do it, but it's likely not harmful. But you got to remember those collagen supplements are supplements, so they're not actually regulated by the FDA, and there's not a lot of control on what's in them, if they're really even that.
Yeah.
So
most people I know don't want to take things that don't have good evidence behind them, so they're like, do I have to take this? The answer is no, you don't have to take it. And I don't think there's great evidence for it.
So a few questions real quick from YouTube. A Curl's View, is the ordinary peeling solution good? It is good. I like using it one time a week or once every 2 weeks. I think it's a nice option. Shamsa, the best products for dark spots. So there's a lot. You can check out my hyperpigmentation on YouTube video on YouTube. It's really good, and it goes over a lot of the most common ingredients for hyperpigmentation. But if you want a nice combination product, there's a product called Faded by Topicals, and you could try that. A Curls, you ask, what's the opinion on eye cream? Is it worth it? So eye cream is definitely out of my top 3, and it may be just barely in my top 5 recommendations. The nice thing about eye cream is it has a lot of the same active ingredients that we see on the face, but you got to recognize that your eye skin, in your eyelids and that, is way more sensitive.
Yeah, it's the thinnest skin on the body.
Exactly. So you want something that's formulated for that area that's not going to irritate it. So in that regard, it is worth it. And then Dawn says, has 11-year-old daughter that's got acne most of her life, is having a lot of trouble on the chin and around the mouth. Help. So if you click my product links that are in my YouTube videos, you can get CeraVe 4% benzoyl peroxide wash. You can use that in the morning, and then you can use La Roche-Posay adapalene at bedtime. You may get a little irritated. Acne may get a little bit worse. It's going to take about 3 months to see your best result from it and steady improvement beyond that. So I sure hope that helps you, Don. Great question, Curls and Shamsa. Appreciate you guys.
I'm going to comment on the daughter thing, too. It's really common to start getting acne, 11, 12, 13, things like that. Having acne for your whole life from being an 11-year-old, we don't commonly see acne in 5, 6, 7, 8-year-olds. Make sure that you are with your pediatrician discussing it, because there are different things that can cause acne. You'll make sure you're not missing something. Having acne in a 6, 7, or 8-year-old usually means that they need to be seeing a physician just to make sure we're not missing anything. So I'll throw in that little caveat.
That's a good point. Yeah. That's a great point.
I want to make sure I didn't skip anybody.
So if you guys aren't following on YouTube and Twitch, I'd certainly like to have you guys over there. Just starting up both of those channels, help reach more people. So if you're not following me there, I appreciate it. I do 3 to 5 minute videos on YouTube, so a little bit more in depth, and on common skin questions. Because on TikTok, of course, I'm limited to 15 seconds. So love to see you guys over there.
Kiara Ivelis, I have combo skin and a very dry forehead, so I'm assuming we're asking a little bit about moisturizers. Once again, facial moisturizers should not be feared. People with acne should not fear the facial moisturizer. In fact, you're almost certainly going to need it in the during your treatment. So I tell people, I tell them to treat it like a prescription. Your moisturizer made for the face needs to go on every day. People that have atopic dermatitis too, I tell them treat it like a medication, because sometimes it's just as important as some of the prescriptions you get.
Yeah, absolutely.
Yeah. All right, what's a good moisturizer that keeps your skin hydrated? So this is from Kiara Ivelis. I use CeraVe, but it doesn't seem to help.
Yeah, so you could bump it up a little bit. There's this La Roche-Posay Tolerian Double Repair Facial Moisturizer, and it is actually quite nice. It's a little bit thicker than your typical CeraVe. It's a real nice option for you, so you could try that out. I think you'll really like it.
All right.
It's got niacinamide, ceramides, all the important things I talked about in my recent TikTok video.
It's nice. It puts a lot of different things in the same product.
Yeah,
so sometimes, if you're like me and it's a struggle to get things on, sometimes it's nice whenever you're able to double dip. The problem is not everything can be put on in combination, which I know we've touched on before. Thoughts on or experience with Kybella?
Yeah, so Kybella, cool new treatment, deoxycholic acid injection for FDA approved to treat the fat that's kind of under the neck, so the double chin essentially. and you inject it, and it ends up like basically breaking open those fat cells. You end up just excreting them, and those fat cells are permanently destroyed. Definitely takes more than one treatment, and after the treatment, you're going to be like a bullfrog for a little while. It's going to be swollen. It's going to be irritated. The procedure is super quick. I mean, basically, you do it. It takes all of, a minute once you get started with the process, and it does burn a little bit, but pretty straightforward. It's a nice option.
Yeah, no, and I've seen it used a couple of times. Once again, I'd recommend doing it under the direction of a dermatologist who is used to using this, because it does cause some inflammation, and you just need to make sure you're doing it with somebody that kind of knows what's going on.
Yeah,
if it's the procedure I'm thinking of, which it is. Yo, Cinnamon, I'm not flirting, but you were both very handsome.
Oh, thank you.
Cinnamon. Yeah, I appreciate that. It's always nice to get a little confident. You care to comment? No, I'm just kidding. That's very, very nice.
Thanks.
All right, 8C and D. 8, what can I use and in what order can I apply what can I use and in what order can I apply for hyperpigmentation on my cheeks? Thank you.
Yeah, so with product, like order of applying products, the easiest way to think about it is just apply it thinnest to thickest. So serums and stuff like that are watery, you can put on your skin first. Thicker creams, or like thicker serums, then creams, and then your sunscreens goes on last. So those are all kind of the options for you there. And then for hyperpigmentation, I would recommend checking out my YouTube video on hyperpigmentation, and that's going to give you a better answer.
I agree. I think it's a really well done video, and a lot of times it's easy to forget what we're saying on here. So I think whenever Dylan mentions these things that he's made these videos on, it's a really nice. Number one, it was probably thought out a little bit more than some of our answers are today. We're answering off the cuff, and there's always a potential that we'll miss something. But those are kind of well thought out, and then you can watch those as many times as you need to get the idea. So I always recommend those. I know he puts a lot of work into them. Let's see.
Yeah. So, guys, we've been going an hour and a half. I think we're gonna have to leave some of these questions for next time. We do stream like Sundays at noon, so you can pop on for a stream on those days. Of course, I'm better at answering questions that are in the comments rather than DMs. I'm on Instagram, Twitch, YouTube, TikTok. You can find me in any of those areas. Ask your questions. Some of the questions from the live chat I'm actually going to try to reply to like in line on the YouTube and stuff. So definitely appreciate you guys all joining.
Yeah.
It was great having you, Perry.
Well, absolutely. Well, thanks for inviting me. Thanks for everyone for treating me so well. I'm going to try to pop in on some of these Sunday at noon and just maybe give a little bit of my perspective in terms of what we're doing. But appreciate you having me on, Dylan. Thanks for everybody for asking all the questions, and I'm trying to get to as many as we can. But look forward to seeing you guys next week.
Yeah, thank you guys so much.